shocking. This country actually has one of the highest levels of out-of-work households in the whole of Europe. We've got 1.9 million children in this country growing up in households where no one works. So the role model that those children see is not one of mum or dad actually getting up and going to work in the morning, and then you have generations where that pattern is repeated. So we think a lot of money was spent, we don't think there were particularly good results, and we think the increase in prosperity that a lot of people enjoyed actually passed a lot of the poorest fellow citizens by, and we don't think that's good enough, which is why we are embarking on the reforms we are. The programme we're going to bring in, we will work with people for longer than the current system. We will start sooner, giving people personal intensive help, and we will actually put more money towards those who are hardest to help, probably particularly relevant to this group, and that will include many of the people that you helped, those people that have drug and alcohol problems. And the way the government is doing this, we are looking to both the commercial sector and what I call the not-for-dividend sector, the voluntary sector, the community sector, to run these back-to-work programs. Now, they do that already. There are companies you may be familiar with, like Action for Employment, Reed Employment. They're some of the big national ones. But there are many very good small local voluntary organisations who already do fantastic work in getting people back into the workplace. And we are again going to pay them by results. They will only get paid, and it will only be sustainable for them if they get enough people back into work. Now, we think that will be a much more effective way of doing it. It's worked successfully in Australia. It's worked successfully. Can I take questions at the end? Would you mind? I think this is a bit alive. Yeah. I'm very happy to take questions, but I didn't have to come here this morning. I've given up a morning. I did it very willingly. But if you would just do the courtesy to listen to me, I will answer questions at the end. Thank you. Now, it's worked, this model, successfully in Australia, in the Netherlands, and in New York. Plenty of business people, aren't there, who complain if levels of tax are too high, and yet the poorest people in society are effectively taxed at an even higher rate when they try and do the right thing and get back into work. And we think that's wrong, and we're going to do something about it. So in broad terms, we're looking at around a 65% withdrawal rate. In very simple terms, what that means is that for every extra £20 you earn, you can guarantee you will have at least an extra £7 in your pocket. And at the moment, people, you go like, well, it's okay, it's not much, but at the moment, for some people, it might only be £1 or £2, or they might be worse off. So it's actually a lot better, it's a big improvement on where we are at the moment. We're going to get rid of the 16-hour rule and the 30-hour rule. I bet many of you know, perhaps you probably work with drug and alcohol users who perhaps might be able to cope with 8 or 10 or 12 hours work a week, but they're not able to do 16 hours a week. And that's a significant number at the moment, because that's when tax credits kick in at a significant level, and again at 30 hours. So by just having a constant withdrawal rate, probably of around 65%, it will make it much easier for people to do the number of hours that fits their life, that they want to do, without finding that they are losing out significantly on benefits, as happens at the moment.
I must say, we had concerns about the drug strategy, we still have concerns about the drug strategy, but there were some surprises in there. There was an acknowledgement that medical-assisted recovery can and does work. Chris Ford was very pleased. There was also recognition that parents who use drugs, that their children should not necessarily be a concern to social services where there is drug use, and that it should be determined by the mom himself. Diamorphine prescribing was even mentioned. Yeah, big surprises. But with welfare reform, as I said, within drug strategy, not so much concern. It's the wider reform agenda that really concerns us. The real concern is that if conditionality is roped into one benefit regime, and someone is, for example, found fit to work or hasn't complied with the system, that not only their income part of the benefit will stop, but the housing benefit will stop, and there will be no way of us getting it repaid. So that really has to be considered. And this is where we're at with decriminalisation. Portugal has decriminalised all drug use, possession of all drugs in 2001. It has had incredible outcomes. The evidence is overwhelming for the positive experience within that country. People find it easier to access treatment. They're not stigmatised by reason of a criminal record or the risk of criminal prosecution. The reduction in drug-related deaths is incredibly significant. The reduction in HIV transmission is significant. In Australia, Simon Lenton, who's an academic there, who really pushed for decriminalisation of cannabis, has actually linked in his research that the decriminalisation of cannabis has led to increased employment prospects for people who were using cannabis. So there's really interesting experiments all over the world. They're no longer experiments, they're actually the legal systems of these countries. And look at it, I mean, we have Europe, we've got USA, California, the sixth largest economy in the world is considering regulating cannabis. We have Australia, we've got half a dozen countries in South America. This is not a loony, left-wing liberal organisation like Release just calling for it. The evidence is out there. We make this work. And it's time for, we are very epic. And it is time for governments to be brave. It's time for governments to really stop criminalising what is essentially a health and education issue. Thank you.
Now, as a result of the comprehensive spending review just being by the government, local authority budget cuts, Liverpool to the tune of 1,500 public sector jobs, Manchester 2,000, and then there's the knock-on effect in the service sector. So where is this job creation coming from for sustained employment? Even with the lack of information around apprenticeships and work trial and all Niamh's concerns, this does not stand up. Where is this job creation coming from?
It is predominantly going to have to come from the private sector because we have overspent as a country for a long period of time and we've got more and more in debt and the interest payments are huge. And it's not just me saying that. If you look at the Office for Budget Responsibility, they are predicting an increase in employment throughout every of the next few years, every year of this Parliament. So, and we are doing things to stimulate that by reducing corporation tax, by a regional growth fund, by scrapping the increase on employers' national insurance, by trying to rebalance the economy. So there are many initiatives, and you'll see a lot more in the budget to try and stimulate private sector growth.
And our project has had 99% success rate. 4 years down the line, everyone that's been on the project after 6 months are all employed. And we're getting told now that intermediate labour markets are too expensive. And after June, we're getting no funding.
I mean, I'm obviously sorry to hear that. If you've been so incredibly successful, I didn't have an immediate answer as to why you're being closed down. But what I would suggest that your project does is talk to the welfare to work providers, the prime contractors that they're called, who will be appointed for your area quite quickly. If your project has that level of experience and that level of success in getting people back to work, I think that the prime contractor in your area will be mad not to talk to you and use the expertise. And we have actually insisted as a government that small and voluntary organisations are part of the Welfare to Work programme. So go and find out who your prime contractor of your area is, speak to them. If you have problems, contact me in the House of Commons and I'll see what I can do.
My landlord is amazing. They have not raised my rent in the last 6 years. It's at least £15 to £75 below local market for rental. And yet I had a letter 2 weeks ago from the Housing Benefit Office to say my housing benefit is going to be reduced by £80 a month.
Yay.
What am I meant to do?
One thing we are doing is significantly increasing the discretionary housing fund that we are giving to local authorities. Now, I don't know your individual circumstances, but your local authority, go and speak to them about the additional money they will be getting on their houses, on their discretionary housing fund, and that, I hope, will enable you to bridge that shortfall.